One of the most transformative medical errors in modern healthcare history occurred in 1994 at Boston's Dana-Farber Cancer Institute, a world-renowned cancer treatment center affiliated with Harvard Medical School. Betsy Lehman, a 39-year-old health columnist for the Boston Globe and mother of two, was being treated for breast cancer. In December 1994, she received a chemotherapy overdose 4 times greater than the intended amount. The error occurred due to a miscommunication in how the drug's dosage was calculated and recorded. Tragically, Lehman died from the overdose. Initially, her death was attributed to her cancer, not recognized as a medication error. The error might never have been identified except for a remarkable coincidence. 3 months later, a pharmacy technician reviewing records noticed that another patient with a similar name had received the same massive overdose and survived with severe heart damage. This discovery prompted a review that revealed Lehman's fatal overdose. The institution's own investigation showed multiple failures across the system, from prescription to verification to administration. The systemic failures exposed included a lack of independent verification. No second clinician had independently recalculated or verified the complex chemotherapy dosage. Poor communication was another factor. The prescription was ambiguous, using total dose over 4 days rather than daily dose. There was also an overconfidence in technology. The hospital's new computerized system was assumed to prevent errors. A hierarchical culture meant junior staff didn't question the attending physician's orders, and there were no standardized protocols for high-risk medications like chemotherapy. The case made national headlines when reported in the Boston Globe in 1995. Dana-Farber temporarily suspended its bone marrow transplant program, and the Massachusetts Department of Public Health investigated and cited the hospital. Transformative changes followed. First, a national wake-up call. This wasn't an isolated case. The Institute of Medicine's landmark 1999 report, "To Err is Human," cited the case, estimating 44,000 to 98,000 Americans die annually from medical errors. Second, the 2-person verification standard, mandatory independent double checks for all high-risk medications, especially chemotherapy. Today, this is standard practice worldwide. 2 qualified professionals must independently calculate and verify doses. Third, standardization of protocols. Development of standardized chemotherapy order forms with clear, unambiguous language, and a requirement for pharmacists with specialized training in oncology medications. Fourth, a cultural shift in healthcare, movement from blaming individuals to analyzing system failures. Creation of safer reporting systems where errors could be disclosed without fear of reprisal, and implementation of timeouts before procedures. Fifth, the patient safety movement, establishment of patient safety as a dedicated discipline within healthcare, and the creation of organizations like the Institute for Healthcare Improvement. Betsy Lehman's tragic death became a catalyst that transformed how hospitals approach medication safety. Her husband, Robert Distel, worked with Dana-Farber to establish the Betsy Lehman Center for Patient Safety, ensuring her legacy would save countless lives. Today, the protocols born from this error, independent double checks, standardized orders, and a culture of transparency, are embedded in hospital systems worldwide. The case remains a sobering reminder that expertise and good intentions are not enough. Only deliberately designed systems can reliably prevent human error. The painful lesson learned: in healthcare, the right system doesn't just support good practice, it makes errors difficult to commit and easy to catch.